Hi, my name is Reid Mitchell and I'm a PhD student in Dr. Jordan Guenette's lab. I'll be presenting the following results from a case study titled Cardiopulmonary Exercise Testing in an Individual 4 Years After an Extrapleural Pneumonectomy. The case report participant was a physically active 59-year-old female that underwent a left-sided extrapleural pneumonectomy in 2015, which involved the removal of the cancer-affected lung, half of the diaphragm and the pericardium, which were reconstructed with Gore-Tex mesh, and the partial removal of the sixth rib. The purpose of this report was to characterize the physiological responses to maximal incremental cycling exercise 4 years after this procedure. Figure 1 shows CT scans before on the left and after on the right. Here you can see the diaphragm is reconstructed with Gore-Tex mesh, the left thoracic space is filled with fluid, and the left side of the rib cage is contracted together, which significantly impacts chest wall expansion. For this study, we had the participant complete a maximal incremental cycle test whereby the work rate was increased by 20 watts every 2 minutes until symptom limitation. Moving to the results, Table 1 shows the peak exercise responses to maximal incremental cycling, while Table 2 shows the CPET responses of the case report participant in the black markers and the dotted lines, in comparison to well-matched healthy female controls in the white markers and the dashed lines. Here you can see the case report participant achieved a peak work rate that was 88% predicted and a peak oxygen consumption that was 71% predicted. Heart rate and oxygen pulse followed similar patterns to healthy controls. While ventilation for a given production of carbon dioxide was elevated after the first few stages of exercise in the case report participant. In addition, the relationship between ventilation and carbon dioxide production for a given work rate was elevated in the case report participant, demonstrating ventilatory inefficiency during exercise. Lastly, tidal volume plateaued early and remained constrained during exercise, whereby breathing pattern increased rapidly in order to compensate for the limited tidal volume expansion to increase ventilation, which likely contributed to the ventilatory inefficiency during exercise. In conclusion, the participant showed evidence of mechanical constraints on tidal volume expansion with a small ventilatory reserve at peak exercise. And ventilatory inefficiency was exacerbated by a rapid and shallow breathing pattern. Despite these limitations, the participant achieved a relatively normal percent predicted peak work rate, which may reflect a high level of physical conditioning of the participant and points to the importance of maintaining a high level of physical activity post-extrapleural pneumonectomy.